You are watching Access LaPorte County, Channel 97. Coming up next is the April 18th, 2023 meeting of the LaPorte County Board of Health. You can find more information for this meeting by visiting www.accesslaportecounty.org.
All right. Welcome, everybody, and we're going to call the meeting of the LaPorte County Board of Health, April 18th, 2023 meeting to order. Ms. Davies, roll call, please.
Thank you. Dr. Uhas.
Present.
Dr. Dora.
Here.
Dr. Nelson.
Here.
Dr. Manning Cox.
Here.
Ms. Lawn.
Here.
Mrs. England.
Here.
Thank you.
Thank you very much.
Mrs. Arnold.
I'm present too.
I am so sorry. Yes, you are. Okay. Thank you.
All right.
Now we are good to go.
Now we're good to go. We're all here.
We're here.
And we'd like to welcome our new board member, Erica England, RN, Nurse England. Hi, could you say a few words about yourself and your background, hon?
Yes, ma'am. Hi. My name's... Am I on? Okay. My name's Erica.
Yes, it is.
Okay.
She needs to get, can you guys hear her?
I'm sorry, I'm very soft-spoken.
We have to pull it closer.
Okay. Okay. I actually grew up in Chicago, and I have been a nurse since 2009. I was in the military for 4 years, stationed in El Paso, and then I have come back. I worked in Illinois at a few various places, labor delivery, home health. I've done med surge over in Texas. I was postpartum, a well mother baby unit, pre and post surgery. So I've done a little of this, a little of that, and I homeschool my children. And yeah, I've been married since 2011, and so we've resided. I mean, my husband grew up in LaPorte, and we've resided in LaPorte since we came back from the military. So yeah. Thank you.
Thank you. What branch were you in?
The Army.
Thank you for your service. Thank you. All right. And the next item on the agenda is the approval of our minutes from January 24th. Do I hear a motion to
Move to approve.
I'll second that motion.
Okay. Any discussion? If not, then let's vote. All in favor? Dr. Dora?
Yes.
Lauren Arnold, yes. I believe if all of us are here, I don't think we have to do a roll. You want to do it that way?
Yeah,
Okay.
just for now.
All right. Very good.
Okay, so Ellie, you approve the minutes?
Yes.
Doctor?
Yes.
And Erica?
Yes.
Okay. And no one disapproves, so it's unanimous. The minutes from January 24th, 2023 are approved. And next item on the agenda is the Health Officer's Report. Yeah, I'm just gonna do it.
Are you talking to me or to? Oh, we need to add public.
Are we good?
On our agenda, we're missing the public comment section.
It's missing
Okay.
the agenda.
So
Do you want to do it at this point, or do you want to?
It's up to you.
We can do it at this point. I see one member of the public that might. So at this point, we will open the floor to public comments. Does anybody have anything to say from the public? Going once, going twice, third time public comment? Anyone? No? Okay, public comment is closed. Next item is the Health Officer's Report.
And again, as always, we start with COVID. There's still, but 95% of the cases right now are related to Omicron, to the XBB.1.5, and weekly cases are around 134,000 being reported. But again, of course, we know so many are not reported that I'm not sure how accurate that is. Deaths are still up to 2,000 a week, and the hospitalizations is about 1,200 a week. All these numbers are trending down in terms of the numbers reported, numbers in hospital, and the deaths are all trending down at this time. There are concerns that there are new variants that may start to come through the summer or winter, but at this point, it really is related to this one variant that is causing the cases at this time. Approximately about, I've read different numbers, anywhere from about 16.7 to 18% of people are boosted, so are fully vaccinated and including a booster, at least one booster. And we talked the last meeting, I talked about opioids, just again as an informational thing as much as anything also, but it's it's an ongoing healthcare problem. Most recent information states 7+ million people are dependent on drugs. It's a huge number. 15% of this group receives treatment, which is even a worse number. There's just no treatment programs for the vast majority of people. Even if they do want it, they can't get it. Due to the lack of adequate treatment programs and the cost for the individuals. Tobacco abuse, which people don't always think of as a drug abuse issue, but of course it is a leading cause of preventable death. So, I mean, obviously it's still a huge issue for people smoking. Last year, they totaled greater than 48,000 deaths, specifically attributed to tobacco, and obviously significant morbidity that goes along with it. A couple of the things that was just as much as anything was for interest is because it is in the news. Candida auris has been in the news recently. It was originally discovered in 2009, and it is an emerging global health threat, although not so much at this point. It's mainly a threat to people who are seriously ill in the first place and have invasive tubes, feeding tubes, intravenous, central lines, that type of thing. And 1 in 3 patients with it die. So, I mean, it is really quite significant in terms of the mortality for it. Luckily, it's not that many. In the past 12 months, there's been about 2,300 cases that have been reported. It is difficult to culture, so probably there is more out there than we know. But as of March 29th, when I wrote this, in Indiana, we've had 87 clinical cases, no deaths. Illinois, I've had 276, and I've had some deaths. So it's something that's out there. It's as much as anything just for information if people are reading about it, but it's a fungal infection. Treatment's very difficult, and as seen by the fact that up to 1 in 3 people who are critically ill die from it. So it is something out there. Another one is starting to bother our area, but not as much as in the east, is there's a tick-borne disease. It's called babesiosis, and I have to practice that one. It's a tick-borne disease, and it's caused by the same, carried by the same tick that carries Lyme disease, but it is significantly different. And it's a primary issue in the upper Midwest and in the Northeast area. It's spread by deer ticks, as I mentioned. It can be mild to severe, and it's very difficult to diagnose because it is incredibly non-specific with the symptoms. Just like a lot of people with Lyme disease, they have it forever till finally they get the right test, or they can actually prove it by testing that they've got it. And the treatment basically is the same thing, or the prevention, is the same thing with any kind of ticks. You know, wear proper clothes, stay on the path, use insect repellents, and probably the most important part is if you are in any of these places, have a really good body check done. There is some drug therapy available, but it again, the problem is by the time it's diagnosed, a lot of people have really significant symptoms in that too. The disease is moving up more into the northern states, and that's because they feel climate change. So we've had 5 reported cases in 10 years. So obviously we probably have more cases than that, but it is something that people are starting to look and test for more in non-specific illnesses. So I think that's it.
Thank you, Doctor.
Questions?
I just read something on that famous medical journal Yahoo this afternoon, and there's a new booster that they're putting out for people 65 and older and with risk factors, and it's a bivalent.
Unless something came out on Yahoo today, it had not been approved yet. They haven't given a set time for it to be approved to start. But the last thing I read when I was doing this was that they expected it to come out in the fall and perhaps hopefully be combined with the flu shot.
Okay, yeah, they were talking about once a year.
Yeah,
That was the hope.
right.
It was a little confusing. I was reading.
But I hadn't understood, like I said, I haven't looked at it. I've been away, so I haven't done much reading on about
I
these
just thought I'd
things.
mention it because,
Yeah.
like I said, I
But there is that they are looking at it, and there is some question about whether it will be approved, from what I understand. But if it is approved, they feel they won't put it out until the fall, was my understanding.
Okay, thank you. All right, anything else, Doctor, or is that
That's it, I think, unless anybody's got
Yes.
questions.
any questions?
Yes, I had just heard something about,
Mike,
oh. Thank you. I had just heard something about a new expression of COVID, which expresses as conjunctivitis, mostly in children and red eye. And I was wondering, have we've had any of that, if not in the state, in the county?
Not that I'm aware of. I know that that's one of, like I said, 95% of the cases plus are related to this one variant. And I'm sorry, I forget the exact designation of it, but it was like 1% of positive cases. And as far as when I did this a couple weeks ago, there was no suggestion that it was in Indiana.
Yeah, the only
But
thing.
they are expecting it, you know, not necessarily that one, but there is an expectation that there will be more mutations. And that's one of the reasons that I read that they're putting off bringing out another booster rate at this moment, because it would be boosting for what we've already been boosted for primarily. And is there going to be some significant changes in the next bit? And is it worthwhile waiting to when the flu shot would be coming out? That whether you not necessarily would have to get both, but they're talking about that would be the timing of it. And by that time, of the 95% that are Omicron, are there now 80% Omicron, and some of the lesser ones, lesser expression ones right now, will they be going up, and do they have to be included?
You know, the only thing that bothers me is when I see these articles or read something and it's always, oh, it's getting better. And then you get to that part where it says, unless it's the, you know, at-risk population, seniors, people with immune compromise. And then you're sort of like, well, you know, a good chunk of the population is senior.
I know, but the thing being is that the biggest problem is, as I said, there's 18% of people are boosted. 18% of people that are eligible for a booster have been boosted. So, you know, you can bring out all the boosters in the world and you can do them for all the different ones, but if we can't encourage and talk people into getting them, you know, I find it a little bit frustrating, but yes, people who want to protect themselves do a really good job protect themselves and get all their shots. But unfortunately, there's still so many people out there that have not, and that can allow for more disease, obviously.
Any other questions for Doctor? If not, do I hear a motion to accept her report?
So moved.
Is there a second?
Second.
Okay, all in favor?
Aye.
Aye.
Anyone opposed? Doctor?
Aye.
You're good? Okay.
A little slow with my eye, sorry.
Yeah. Next report on our agenda is the administrator's report. Ms. Lana?
Good afternoon. I first want to say hi to everybody, and it's awesome to have a full house. I was just sitting here thinking, this hasn't happened since 2019, that we've been able to have a meeting and everybody be present and sitting closer than 6 feet apart. So, without masks, yes. So yes, thank you for everybody for being here today. So I'll try to be brief. I know it's a long running joke because I can't be. So again, I mean, but I updated you last time a little bit about the flood itself had been very recent. It had just happened a couple weeks before. So here we are into April and we're still mitigating that. So again, real briefly, we had the flood on the line break on the 5th floor, which flooded that entire section of the building down to the basement, affecting all the floors. So services have been moved out. Health department, I'm here part-time, well, most of the time, trying to be more in Michigan City as well. But our services are still up and running. We have all our nursing services at the courthouse in Michigan City. and then everything else is at 8th Street. So our old office. We still had that building, the county still had that building, so they're able to relocate us there into our old space. The coroner's office is there, the building department is there, part of IT is there. EMS is still in this building. They moved to the other side into the basement. The sheriff's is still operating out of this building. There is definitely progress happening now. Things have started to move very quickly. The floors have been emptied. We're still doing some mitigation and demo in areas, but hopefully very soon we'll be able to start putting Humpty Dumpty back together. And hopefully, I don't want to jinx, knock on wood, maybe by the end of the year we'll be back into our new space. So really my best laid plans for the year just totally fell apart, as I'm sure many departments did. But we're going to keep moving forward. The one big thing we weren't able to trying to figure out was what we were going to do with the lab. We had different ideas that we were still going to be able to keep the lab open and operating, with the little finagling design to be able to get back to the lab, until we found out that the lab itself had also been damaged. We thought it had been spared from the flood, and the deeper you get in, the more you found out. And that has been gutted at this time also. So our floor is completely gutted. Our lab tech, Cindy Ebert, was able to work with Yes Laboratories out of Mishawaka. And they kind of reached out to us too and saying, what can we do to help you? And we are able to still accept water samples, so it has to be done at 8th Street in Michigan City and only 2 days a week. But they are doing our testing for us and at our prices, which they didn't have to do, but they were working. I'm just very grateful that they're able to do that. You know, we're the only public laboratory in the entire county, and still be able to provide those services. More than half of the county is on a private well. Businesses are on private wells. They have to, by law, by IDEM, test their water so many times a year for bacteria and nitrate. And now they can still do that within the county without having to travel to South End or Mishawaka or Maryville to do that. We're also going to be able to do beach sampling. We're going to work with Michigan City Sanitary District, and they're going to run our samples for us. We're still going to collect them and do the paperwork, and they're going to do those samples for us in their laboratory. So all of that is running smoothly right now. So you can still all go swimming this summer. Inland, pardon?
Good job.
Yes,
Well done.
I'm very happy that we're able to do that.
Yeah.
Our fetal infant mortality group is working very well, moving forward. They had a initial meeting in December, which was just a welcome meeting for everybody to get together and what the expectations were to be serving on that team. January, February, March, they were able to hold a meeting each month. 1 month, no, February they weren't because somebody was sick. But they're meeting once a month. Try to review 2 to 3 cases each month, and they're going to be meeting the second Tuesday of each month. And we're looking forward to be able to get a little bit more data, a little bit more information to see what we're going to be able to provide to the community action team to put some of the recommendations into place. We finally were able to select a vendor for our electronic medical records. So we're going to get rid of paper records. Everything done in our clinics will be done like in a real doctor's office. You walk in, you have your little iPad, you fill out your information, all the charting and everything will be done on the computer. We'll be able to eliminate, we'll not have to continually figure out where we're going to put the rest of the filing cabinets at as we fill them, continue to fill them out. So that's exciting. And it also allows us to accept private insurance. So right now the only clients we can see is if A, they're paying cash, or D, they're on Medicaid. for childhood immunizations. So we're not able to take in anybody for shots if they have insurance. They have to go to their doctors, and that's not always convenient. When you can come in for 20 minutes here and not have to wait a month or 2 months to get in just for that. So we're excited to get that up and running. We had our initial meeting last week. We have another meeting tomorrow, and it's going to be weekly meetings for the next several months here while we go through training and get our program built out. On the back page of my report, show and tell, our trailer got delivered, and it got delivered ahead of schedule. I plan to have it set out at the fair. We're still learning it. We have quite the learning curve on this. It has all the bells and whistles. It has solar power. It has a generator. We can plug it in. We can unplug it. We can plug it into water. We have a water tank. We have a bathroom. We have a VFC fridge. We have a camera system, security system, UV light, disinfectant. So it's going to be awesome to be able to get that out on the road, be able to use it as a mobile clinic, be able to use it as an emergency response vehicle, headquarters, whatever we need to do. We're talking about maybe, I won't talk about. Danielle says, like, oh, we can get some cots from EMS and we can, or EMA, and have that in there in case we have to stay overnight. I'm like, we got power. I'm getting an air mattress. We're not sleeping on cots. No. But it does have, it is pretty much, we'll be very self-sufficient. We're going to be completely self-sufficient with that. We won't have to rely on anybody.
Where is it located?
Right now it's sitting out on County Highway.
Okay.
Yeah, it's out in the back 40. I tried to drive by one day when it got first delivered. I was all excited. It got delivered on a Friday, and I was gonna Saturday. I'll be able to see it from the road, and you can't. And I was just like, where is it? Maybe they parked it inside. No. So really the last thing on that is getting our vehicle. And I finally got one ordered. It was an order that fell through. I called and they said, we got this truck. If you want it, get me the paperwork. So we will have a truck by the end of the summer.
What size truck? What would you guys get?
It will be a Ford 250.
What size?
It's a 3/4 ton truck.
Wow.
Yeah, with a crew cab.
Who's gonna be the driver?
We have a couple of volunteers. I mean, we have somebody in the office that has a CDL. Not that you need a CDL. We have 2 people that have horse trailers and tow horses all the time. So we have somebody that volunteered to let us come out on their property and drive in circles until we're comfortable with it. So I'm good as long as we don't have a 90-degree turn. I'm good. I can do it. 45 or back it up.
Or park it.
Or park it. I'll just go straight. I'll be fine. There's no turns in the county. I did give you a little bit of update at your seats about the Governor's Public Health Commission. Just to give you kind of an update and to keep that in everybody's mind, because that is in legislation right now, which is ongoing until the 27th. I think they have to end by the 27th. It has passed through committee, but there have been several amendments made to it. What you have there was Dr. Box's recommendations for the bill. Some of the things that have changed is one that they've cut the funding back. Legislation has. They've cut it back from the first year was supposed to be 100 million. They've cut it back to 75. Going forward, it's supposed to be 200 million a year, and they've knocked it back to 150. So essentially 25% reduction in funding. And then they wanted to add services on top of that, things that the health department doesn't even do. And the state and everybody else was like, if you want us to do more than what we're doing, you need to give us the money back. So whether or not that is going to drop or change, I don't know. Again, it changes every day. We get email updates every day on what has been added, what's been taken out. a couple of the bigger changes, other than the money being taken away, is instead of an opt-in every 5 years, it's every 2 years. So every 2 years, the county can be in or out instead of 5. They, again, part of this, in doing this, we have to meet the core services. So give us the money and let's do the core services, and we have to meet indicators. Awesome, we can do that. Now they want to split the money, that 60% of the money we give you can only be spent in this group of items, and the other 40% can only be used in this group of items. That is how Highway Department receives their funds from the state, and I've been told it's a complete nightmare to try and manage. I don't understand the reasoning behind that. If we have to meet the key performance indicators, we should be able to use the funds as what we need to do to make that, and not have to do those two different, another budget essentially. So that's a little frustrating. I know there's continuing to work on that. And another thing that I think has everybody up in arms, and I hope they change that, is that they are trying to control on how we hire people now. That anytime we have a new hire come in, anytime we want to hire anybody in the health department, whether it's a new position or replacing a position, whether it's county money or whether it is money coming from that grant, the job itself has to be posted for 30 days, and we can't interview or hire anybody until that 30-day period is over, which is just hamstringing us. And it's, especially in job markets today, you can't take that application and put in an application and wait 30 days to see whether or not you're even going to get an interview. In that 30 days, if you get another job offer, you're going to take it, right? So I don't know what the thinking is behind that, and nobody else has that restriction on them. So I don't know why they're trying to put that onto the health departments. So those are some of the concerning things. There's others, but again, it's still very much in the air exactly how much money we're going to get. And whether there'll be more amendments or whether these amendments are going to be amended again. But we'll know May 1st for sure what kind of money will be available to the county health departments. But again, as citizens of the great state of Indiana, we can all contact our representatives and express yourselves however you feel about any subject, but currently what's in legislation. Please feel free to do so at any time. And I will leave it there. If anybody has any questions, I'll be more than happy to try and answer.
Any questions for our director? Okay. Do I hear a motion to accept the report? Anyone?
Motion to accept.
I'll second that motion.
All right. All in favor?
Aye.
Aye. Aye.
Anyone opposed? No. The administrator's report is unanimously accepted. The Environmental Health and Food Division Supervisor's report.
Hello?
Howdy.
Hello. Can you hear me?
Yeah.
We have a new public health clerk, which was very much needed. Her name is Tara. She's doing very well. She came from the payroll department in the county, so she's familiar with the county. And I think she's been there for about a month now. So that's going very well. In the health education area, she had one health education event in the first quarter. 17 car seats were given away, 2 seat checks. She had 5 Narcan trainings, and 120 doses of Narcan were distributed in the first quarter. We are starting a mosquito surveillance program in the county. That's being organized by inspector in the department. It will be ready to go for this mosquito season this year. All the mosquitoes will be sent down to the State Department of Health. So that's underway. It's not underway, it's just being organized at this point and ready to go. We did have radon month in January. Didn't go too well because we're not in LaPorte anymore, and the majority of the people came to LaPorte to pick up the radon kits. So very few were given away, and those people apparently don't want to go to Michigan City. So we have a bunch of kits left over. If anybody knows anybody interested in a radon kit, we still have a bunch left. There were 33 septic inspections that were done in the first quarter. We still have 2 septic cases that are with the court, that are with Nelson right now in the court system. 3 cases total because 1 is a trash and garbage complaint that still isn't resolved. 38 complaints were done in the first quarter, environmental complaints. And the food inspection staff did 419 food inspections. Questions about anything?
I have a question. What mosquito-borne viruses are you looking for in this mosquito surveillance?
I believe they test them for West Nile and Triple E.
They do test for West Nile virus and Eastern equine encephalitis. They will do a sampling looking for like lacrosse fever and those items. Sometimes they'll send samples out to CDC also. But, yeah. And we have always had a mosquito surveillance program. It just has died from COVID. So we're getting it back up and running.
Right.
Any other questions? If not, do I hear a motion to accept the Environmental Health Food Supervisor report? Motion.
So moved.
Second?
I'll second that motion.
Any further discussion? If not, vote. All in favor say aye.
Aye.
Anyone opposed? Okay, the ayes have it. The report is accepted unanimously. Next item on the agenda is the nursing supervisor's report.
Good afternoon.
Good afternoon.
Aye.
I don't.
Starting off this quarter, we toured the PACE program through Franciscan Health. We had never really heard of that program before, but we were starting to get a lot of referrals out of that program to the health department. So they invited us for a tour and an overview of the program. And in a nutshell, what it does is it serves as a one-stop shop for complete health care and social needs for senior citizens in a day program. So I have a handout on it if anyone's interested, because I was really surprised we had that in our county, and there are a lot of people that take advantage of that program. All of the nurses participated in a tuberculosis recertification this quarter. This is both a test and a skills check, and it allows us to be able to interpret, read tuberculosis tests, and we have to recertify every 3 years, which is a requirement for all health department nurses in Indiana. The Indiana Department of Health announced changes to the communicable disease rule. They updated some of the reportable conditions, took some of the reportable conditions off, and also published some control measures and guidance documents on their website. This all took place, it started on April 1st with the new rule. I just wanted to mention that the state does have a flu dashboard that's updated each Friday. It's on the State Department of Health website. It gives surveillance data, county data, regional data, along with breakouts by age on the current week. It also provides current levels of flu circulating in our community. We saw 359 clients for immunizations and administered 798 vaccines in the first quarter. We did follow up on 2 lead levels that were elevated. We performed 128 tuberculosis tests, followed up on 70 communicable disease reports, and saw 3 clients for travel immunizations. And I'm happy to report we did start our confidential services clinic back up, along with our blood profile clinic, which are very popular in our community. So our clients are very happy that those are back, and they're very well attended. So we're happy about that. And that's what I have.
Can you tell us a little bit more about this PACE program and how? Who are they referring to you guys, and how?
They're referring positive tuberculosis tests to us because everybody that participates in that program has to have a tuberculosis screening.
Okay.
It's funded through a combination of Medicare, Medicaid, and private pay insurances. They have to be 55 or older, reside in LaPorte County. They have to have a chronic condition that would qualify them for home nursing care, and they're able to live safely in the community.
What does it mean that it's a day program format?
So they go to the old Franciscan hospital.
Yeah.
All during the day, and they have physical therapy. They have they give them their medications. They even have showers there, so they can shower there. It's like being in maybe an assisted living or something during the day, but then it gives their family some respite if they have to work.
That's what what I was thinking of.
Yeah. So it's a great program, and I had never heard of it until we started getting these referrals. So
it sounds like a good idea.
Yeah, I have flyers if anybody wants those.
Excellent. Is there anything else, Jennifer?
No, that's all I had.
Does anybody have any questions for Jennifer on this report? If not, no discussion, then I'll take a vote. All in favor?
Aye.
Make a motion to accept the report,
So moved.
Motion to accept.
and then second the motion, and and then a vote. All in favor?
Aye.
Aye.
Anyone opposed? No. The ayes have it. The report is accepted. The next item on the agenda is the attorney's report.
Good afternoon, everyone. I do have a few things to report to you all. During this reporting period, we have been working with Ms. Tricia regarding some cases that have been referred to our office. We had a total of 6, and 2 of them have been dismissed because they have complied with our requests. It's amazing whenever you file some legal complaint how quickly people respond. So I say that jokingly, but it is an effective process that we have with the health department. Whenever they've tried several times, they send it to our office. You know, if we have to, we file a complaint, and then that usually really gets the people moving on whatever it is that we're requesting. So there were a couple that we filed, and we were able to request a dismissal of those items because of the fact that they've complied with our requests. That leaves 4 that are pending, and we're hopeful that some of those also take the same effect. A couple of them, I'll share with you all, have retained attorneys, and you know, that's helpful because we're able to communicate with other attorneys on how to best resolve the situation. It makes it a smooth process in order to hopefully, you know, resolve these issues without having a contested hearing. I can explain to you all as well that we have had one that's been somewhat difficult because of the fact that it's been hard to provide notice to this individual. If anyone has any questions and details about this, I'm happy to share, but because it's a public meeting, I'll keep it brief. It has been difficult because of the fact that in order obviously to move along with the legal process and file complaints, you have to issue them notices. Well, this particular individual has been difficult to track down. And so we're working on that, and that's that's probably our most complicated one out of the ones that I've just listed, and hopefully that will be resolved before the end of the next reporting period, I would hope. Other than that, things are going well from our perspective. There are some that keep, coming to our office, but we're able to get them resolved. So again, if anyone has any questions and wants details on any of these, we're happy to provide them. And I'll leave it at that. If anyone has any questions, happy to answer them.
Thank you. Are there any questions for Attorney Picardo? If not, I will entertain a motion to accept the report. And then a second.
Motion to accept.
Okay, do I hear a second?
Second.
Okay, all in favor?
Aye.
Okay, anyone opposed? The ayes have it. Thank you. All right. Any old business that, Amanda, that we need to deal with?
No, doctor.
Any new business that we need to deal with? I don't have anything. No one else has anything.
Meeting date.
Yeah, that's the next item. So the next meeting we are scheduled is in July.
When is the fair week in July?
It's on the 8th.
Yeah, that was the second week
Fair
of July.
starts on the 8th.
So should we do it after
Fair week, yeah.
Fair Week? Are we thinking like the 18th or the 25th?
I was thinking the 18th.
18th? Okay.
I was thinking the 18th. If that works for everybody, then let's do it.
If that's a motion, I'll second it.
All right, is there a vote on this? Anybody disagree? Everybody agrees. So our next meeting is July 18th at 4 p.m. I do have a little teensy question. It's kind of new business. And it's kind of about parking. I know this is a result of the construction. So there's nothing we can do about it, but is there any way we could get permits to park down by the courthouse, and then you come out and it's on the left, it's below ground level?
So only thing I can say about that, that's all assigned parking. So with us meeting at 4, if you're here at 3:30, 3:45 and a spot is empty, I'm not going to say it's okay to park there, but I would say let the odds be in your favor.
Was shoot out of there by a sheriff a couple of years ago. Grab by the ear and take it away.
Right.
No.
You're more than welcome to park along the street here and come in through the back door and not have to come up through the ramp in this area, because that is going to be there for quite some time.
Yeah.
I imagine it'll still be there at the next meeting.
Well, a block over, and it's a nice walk, so it's not a killer. I was just wondering if there was some sort. That's fine. I withdraw my question. All right. If anybody else has anything, this would be a good time to bring it up. If not, then I will accept a motion to adjourn. Anybody move to adjourn?
So moved.
Okay, second.
Second.
All in favor?
Hi.
Aye.
Thank you, everyone. Good meeting.
Thank you.